Hi, I'm Dr. Amber Allen, and you may have heard of a really popular alternative to conventional braces called Invisalign. We have a lot of patients that do this, and it's a really fun, kind of exciting thing that we're involved in. Invisalign's been around for a few years, and in that time, it's really proven itself to be effective. I think when it first came out, people had a lot of questions about whether it could actually effectively move the teeth, and people still ask me that, how does that really move your teeth? But it does, and it works. Basically what it is a series of clear aligners that are worn all the time except for when you're eating or brushing. And you wear each aligner for 2 weeks and then switch to the next one, and they just kind of sequentially move your teeth. Here's a sample aligner. They're clear, they're kind of rigid if you squeeze them. We can even wear bleach gel in these, which is fun to kind of whiten your teeth at the same time. But you wear this for 2 weeks and then switch to the next one. And the neat thing about them is that when they're in there, you really can't see them. Everything's wet, the saliva's in there, and patients tell me that coworkers have no idea that they have these in. So then you go to eat lunch, you just take them out and pop them in your retainer case and eat, go brush, and stick them back in. Invisalign has a lot of benefits over conventional braces, and it can't do everything, but it can do the majority of things that regular braces can do. So first of all, as we said, it's really aesthetic. You don't have those traditional brackets and wires bonded onto your teeth. It's also very hygienic. Because you can take those out, you can brush and floss the way that you normally do. And that also tends to lead to a lot less decay problems when you're in Invisalign treatment versus, regular braces. And also a lot healthier gum tissue. You don't get this like red puffiness to your gums that we see a lot, the majority of the time, with regular braces. Also, sometimes with regular braces, after you take off the brackets, when treatment is finished, sometimes you'll see kind of this white square on the teeth, and we don't have to worry about that with Invisalign, which is just really great. It's also less painful than braces. Usually, like the day that you change to the next aligner, after 2 weeks is up, you switch to the new aligner, and it's a little bit tight the first day. Sometimes I'll have people take ibuprofen, but most people don't even do that. You'll just notice a little bit of tenderness that day, and that's about it. So it's really comfortable compared to regular braces. And there's also fewer appointments. We only need you to come in about every 6 to 8 weeks. And in that time, we're basically just checking the tooth movement, making sure everything's tracking, and giving you your next few liners and just kind of sending you on your way. So basically, if somebody's a good Invisalign candidate, we have you come in, and we take a real detailed set of upper and lower impressions and some photos and a couple other measurements and send them to the Invisalign company. And from there, we work out the tooth movement in the software so that we can kind of plan the tooth movement from A to B, A being where you are now, to B where we want things to finish up. And this is what we get. This is the software with kind of the computer simulation of tooth movement in it. And it's got different views that you can look at the teeth. You can look at it from the front or just from the top down, just one arch at a time. And then basically you can just hit the play button and it'll show you the tooth movement as you progress through those series of aligners. So from this, we get a pretty good idea of about how long the treatment's going to take. This is kind of the projected tooth movement. Now, is it going to progress exactly like it does in this software? No. Sometimes it does, but it's usually pretty close. And wherever we get off track, we'll just take new impressions and kind of get back on track again. And that's usually maybe toward the end of treatment. That can happen sometimes. But this gives us a pretty good idea of how things are going to go. So it's really a really neat and, like I said, exciting thing that you can do with your teeth, and it's so much easier and just more tolerable than conventional braces.